I think the lab is critically important in patient care because the laboratory is the area that helps with the diagnosis, treatment options, and patient outcomes. And without laboratory data, there are a lot of questions that would go unanswered.
The lab is quite literally the backbone of the hospital. We do work behind the scenes. You see doctors, you see nurses, but you don't see the scientists that are behind the doors.
When the patient comes to the hospital, we don't know what's going on with the patient, but in the lab, through various tests and analyzing the patient's sample, we do get to diagnose with the patient, and we do help the providers too, sometimes to help them guide which test to order so we can help the patient heal faster.
You know, I just actually did a big tour for a big high school group earlier this week, and none of them had ever heard of a clinical laboratory scientist. They didn't know what went on in the laboratory, and they were fascinated. I heard actually just this afternoon before I came in here that they have been nonstop talking about what they saw here. And what I told them was, you know, if you enjoy science, you enjoy math, you enjoy helping people, and you're not really sure what you want to do, look at some of the other careers in healthcare and definitely focus on careers in laboratory medicine, mainly because there's so many things you can do with that career.
Different choices you have with a medical technology degree. You can kind of go the route that I went. You could go into LIS and working in the lab in that regard. And also you can go and work for any of the various instrumentation companies that we have in the laboratory. If you like to work in the lab, but you also like to tinker in machines, you know, you can go and do that. You can go into management. So there's just so many different avenues that you can take with an MLS degree. You're not pigeonholed to just work in the lab the rest of your career.
I think it's important for young professionals to pursue a degree in laboratory sciences because it's an up-and-coming profession. We already are, as a manager, I've noticed that we are short-staffed when it comes to medical technologists and lab assistants also.
Job possibilities and prospects are high for students coming out of college. And also, I just think it's an extremely rewarding career. We have such a great impact on patient care that at the end of the day, you really feel like you're making a difference.
One of the things I would really advocate any new people going into the program and those already in laboratory medicine is to speak up about your career, speak up about what we do. Laboratory people tend to be very quiet. We like to be behind the closed door, and consequently no one knows about us. No one knows the role we play in patient care. We as a profession have to get more vocal and tell people about it, encourage students to go into this field, and get involved in multidisciplinary teams.
It's important to stay involved with either their accrediting body, which is ASCP, or ASCLS, which is the American Society for Clinical Laboratory Science. It's very important for our profession to have a voice because we are behind closed doors.